Hey, good morning, welcome back. It's Dr. Peterson's Morning Minute. We're talking about diabetes, and one thing I forgot to mention in the last talks was, well, what are the symptoms of diabetes? I talked about what the problem was, the pathophysiology, but I didn't actually mention what are some of the symptoms. So let's think this through. I have elevated blood sugar, and the sugar is not getting into the cells to work normally. So from a symptom perspective, what I'm looking at here is, well, one, the body wants to get that sugar out of the bloodstream. The way it does that is it dumps it into the urine. As it dumps it into the urine, it drags water along with it. So with that, I'm going to be peeing a lot because I want to get all that extra sugar out. Because I'm peeing a lot, I'm also getting dehydrated. My body says, okay, now I'm thirsty, so therefore I'm going to be drinking lots of water. Increased thirst, increased urination are two of the common causes, most common symptoms, I should say, of diabetes. Additionally, that sugar is not getting into the cells, so my cells aren't working normally. I might experience some fatigue, some weight loss, some blurred vision, some weird neurologic symptoms, just a general feeling of I don't feel well. And that's because the cells of the entire body aren't working the way that they were previously working prior to the diagnosis of diabetes. I'm going to quickly just insert here, how do we diagnose diabetes? Well, we typically do that with a blood test. And it's asked to actually be a series of blood tests. And what we're measuring is two things. We're measuring the actual random sugar level called random glucose. Sometimes we'll use a fasting glucose where there's no eating or drinking for 8 hours before the test. And the second part is we look at something called a hemoglobin A1C. Hemoglobin A1C has been the standard for diagnosing and tracking diabetic control. Hemoglobin A1C, the way this is basically in our body we have hemoglobin, which is a major constituent of red blood cells. That's what carries the oxygen in our body. And what we're looking for is on those actual hemoglobin cells, they can become glycosylated. That's where they actually get a sugar coating on them. And what we're looking at is the percentage of the hemoglobin that has the sugar attached versus the percentage that doesn't. If I have diabetes, I have more of those cells, more of those hemoglobin cells that are sugar coated. And that's what we call the percentage of hemoglobin A1C. How many of my hemoglobin cells are sugar coated out of my total number of hemoglobin cells? Someone who's not diabetic, the hemoglobin A1C should be less than 6, less than 5.5 actually. Someone has a hemoglobin A1C above 6.5 for at least 2 different measurements would meet the criteria for the diagnosis of diabetes. Thank you so much for spending this minute with me today. I look forward to seeing you back next week when we talk about the risk factors that can predispose someone to diabetes. Have a great day.